as to what we want to convince the patient and how we promise the results to the patients. The expectation of the patient has to match what we are doing or what output, the result we are going to create after the treatment or the transplant. So, today hair loss patients are confused and misdirected. They should understand that hair loss is not a disease. There is no medicine which can cure their hair loss problem. Patients come to us, they say, I am having hair loss, just stop my hair loss. It is like telling the doctor that you just stop people from dying in the world now. Science is advanced, there are so many doctors, you are a large community. So, how about stopping people from dying? This is a biological process. Each and every hair is going to be born, is created, becomes young, it grows well, it becomes old, it falls. You cannot stop it from falling, and you have a fixed percentage of hair that falls during the fall phase. So, you are usually having around 20% of hair, 15 to 20% of hair in telogen, that will always be in telogen. Animals will lose their hair once in a year and the entire hair comes back. So, they get 100% hair shedding and replacement. We do not get 100% shedding in a year, otherwise once in a year all of us would go totally bald and then try to grow the hair back. God has been kind enough to us to keep only 20 to 15 to 20% of that hair in the telogen phase. So, this is going to fall, you can't be 0. If that fall is less than 10% or low, then it becomes unnoticeable. So, people think I am not losing hair anymore, and nobody becomes bald because they are losing hair, they will become bald because fallen hair is not replaced with new hair. Now, body feels you can survive without a single hair on the head. So, there is no natural repair or restoration to replace the lost hair. If the hair is gone, your heart, lung, liver, kidney, brain, eyes, everything is functioning normal. It does not affect your normal day-to-day activity or your function. Also, by evolution, it is on its way out. So, there is no natural repair or restoration for this hair. Now, the good news is there are follicles which are willing to grow. They are in a sleeping phase or they are dormant. You can wake them up and you can make them grow. So, for any grade, any age of hair loss in men and women, there will be at least 20 to 30% more follicles which are in telogen or which are in sleeping phase and which are not growing. You can get them in the growth phase and improve the number of hair that the patient has on his head. That directly can be improved. So, but there is no regulation and support for these hair to grow. So, if you stimulate these hair to grow, you support them with nutrition, you prevent them from damage, they will always grow. That is how you get a result. So, stimulation of the hair growth. Stimulation of the hair growth is achieved by using 2% minoxidil or 5% minoxidil. This pushes the hair to come in the growth phase. Now, we also have peptide preparations, tripeptides, tetrapeptides, decapeptides, which mimic the growth factors or the stimuli given in the body for hair growth. Because they mimic the stimulus, they are able to stimulate the hair growth. So, these will give the signals for hair growth or make sure the hair gets a signal for growth, and the minoxidil will extend the growth phase of the hair. That is how it works. Now, very low percentage. So, the minoxidil we are using is just 2 or 5%. So, it acts only for 3 or 4 hours. So, it is necessary to convince the patient at the counseling itself that you are supposed to use this minoxidil 2 times a day, because it acts only for 3 to 4 hours. This is not like taking a pill. You are not taking a minoxidil pill. You externally apply it on the scalp. So, you need to apply it 2 times a day. It can give additional benefit if it is used 2 times a day. So, herbal stimulants also can be used. They are effective but slower. Minoxidil brings the hair roots from fall phase to growth phase. These treatments can add 20 to 30% more hair in 2 to 4 months, and some additional roots which are in sleeping phase can grow back. Now, laser can be used as stimulation for the sleeping roots. There is this 20 to 30% extra hair which is in sleeping phase, which can be stimulated with low light laser therapy. No pain, no discomfort, simple. You just wear a laser helmet or use a laser comb, 15 minutes 2 times a week for 2 months and once a week as a continuation therapy. This improves blood flow oxygenation to the roots, removes or displaces the nitric oxide accumulated in the cells and makes them grow better. Now, how long to continue this support? One hair growth cycle is 4 months. If we follow, say, the support for 4 to 5 cycles, it becomes 20 months. So, this has to continue for minimum 1.5 to 2 years. Now, there is no treatment or medicines we are using to treat or cure the hair loss. We can only support and improve the growth. So, if we stop the support, in the next 6 months to 1 year, gradually the hair will again become slow growing, weak and fall. So, program which we use is having no medicines, has got 0 medicine, it has got vitamins, which is a wellness program, gives good health to the patient plus gives hair growth. So, it is a good program to follow and is easy to follow. Patient can follow it as long as he wants without any thought of side effects.